An omnibus bill passed by a House committee includes efforts to raise pay for home health workers who care for people with disabilities and the elderly. We sat down to learn more about what's in the omnibus bill with one of its authors, Senator Sen Hoffman, who represents Champlin and part of Brooklyn Park.
We were one of the few committees to really get a targeted amount of money that really is going to make a difference, especially when it's workforce development. We know there are 46,000, if you look at home and community-based services, from nursing homes to group homes to working, one-on-one with individuals, PCA, home health, there's 46,000 vacancies in the state of Minnesota. There's over 200,000 people that do that profession. Yet the reimbursement rate, because the only way they make money is if either the state puts more money in the bucket or Centers for Medicaid Services matches that or puts it in there. And the reimbursements are on $14.72. I might be off a few cents, but it's there.
Pretty low.
It's really low, Shannon. When you look at, if I lived in Burnsville, I could get a job. My starting pay at Burnsville McDonald's is $21 an hour.
Wow.
Right? I mean, so you're competing against that. So really the folks that are doing this job are people that are passionate about it. They have a family member, there's something that's compelling to them, they're doing the right thing, or they're going to school for doing what they're doing, and it's like, all right. So we focused. I mean, there was this spotlight on, if we're going to do anything, let's focus on workforce, right? And we did that, right? And from the very beginning, when we had some cash money that was put out, right, to the workforce, knowing that, $200 some million, 200,000, 206,000 people, the money, little bit of money equated to about 50 cents an hour raise. That's it. $206 million really equated to about 50 cents an hour raise. So that's pretty much the focus on it, right? There are some good policy provisions in there that we're looking at, child care. There's some stuff on trafficking that's in there that it's, oh my God, we're still 1,600 people, a year in Minnesota. Child trafficking that's going on. That's like not okay. It's wrong, right? So those are the kinds of things that we try to look at. Telehealth, medicine, those pieces, there's some big sections in there.
Yeah, so we're really seeing, the more of the population, the baby boomers are getting older, and so we've got to have services to match that.
I'm glad you brought that up, because exactly, a couple years ago, we finally hit that bubble where there was more people 65 and older in the state of Minnesota than there are in the K-12 system. K-12 system has been 850,000 people, pretty much consistent, right? 1.1 million 65 and older, and it's climbing. So all of a sudden the Medicaid reaction to that goes from $1 billion Minnesota to $3 billion, right? Because we get a 2-for-1 match from the feds. But that also says, folks that are getting older, they're getting their services. When they go to the hospital, 65% of the people that go to the hospital, it's Medicare or Medicaid that's paying for that. 65%. That's just going to keep increasing. So, it is time, because we know also, Shannon, right? It's more cost effective. Well, it makes more sense. It's a natural, makes more sense for people to be at home, right? So how do we provide services and supports in people's homes? We know it's also a cost effective way, and it makes more sense because people live longer when they're able to be around the home that they love. So that's going to just increase.
Lots to keep our eye on. Thank you very much for being here today, Senator Sen Hoffman.
Good to see you. Thank you very much.
Find more local news stories at ccxmedia.org and follow us on social media.